Hello and welcome. My name is Jodi Scholes. I am your instructor for the MBLEx review course. Welcome! You made it! You're here with live class. Woohoo! Today is a very cool day. We're doing pathology. We're doing pathology of the musculoskeletal system, of the digestive system, and of the respiratory system, which may sound like a lot, but I will assure you we have a renowned expert who's going to be teaching today. And our class format's going to be a little different. Normally we do 3 parts of class. However, today we're doing 2 parts of class. One is a test taking strategy, and it's directly related to the questions that we are going to see today. Because the way we're tackling pathology is we are dissecting 20 or more questions. Whatever our time will allow for, we're getting in there and getting questions that, upon my review, are not only pathology, but they're also client assessment. So, a big chunk of questions today, and this is going to be led by Ruth Werner, who I will introduce to you in just a moment. So 2 parts of class today. First part is a test taking strategy. The second part is our learning, and we're going to be dissecting lots of questions. So let's start with a test taking strategy. Did you know that test questions on the MBLEx are written with distractors? So there is a stem to the question. The actual question itself is called a stem. And you and I have dissected questions, picking out keywords in that stem. But then either your 3 or 4 answers are written with something called distractors. And that is why we need to understand the difference between a good answer and the best answer. Because there's going to potentially be 3 good answers that you're looking at, 3 answers that might be appropriate for massage treatment. But what you're going to see today and what you'll remember for your MBLEx is that you're looking for the best answer. So this is intentional. It kind of stinks, but it is intentional that these questions are written with some distractions. And I see Ruth kind of shaking her head. Do you want to comment on the benefit or downsides of distractors?
Sure. Um, as someone who has written thousands of multiple choice questions, I will tell you that the strategy of the writer, and I really encourage you to think about trying to maybe write some of your own. The strategy of the writer is we come up with a stem and we come up with the correct answer, and then we need to fill in what are some things that are plausible, but just have a little bit of something that's not quite right. Okay. And I don't think it's a bad thing because what it requires is that you, the test taker, be paying attention to all of the clues and be using critical thinking to figure out why this answer is better than that answer. And in the questions I've chosen to share with you today, we'll have lots of practice with that.
Yes, we will. And when Ruth was talking, what I thought about was kind of a puzzle piece. And you know how you get that puzzle piece that kind of fits, but you can tell it's just not the best fit? That is exactly what we're looking for in these questions. And you can see as we go through these questions, oh, now I see what you're talking about. And I hear that all the time in our tutoring sessions. Oh, now I see what you're talking about. And because Ruth mentioned critical thinking, and I liken that to a detective, where you're pulling out these key pieces of the question and applying the answers and seeing which is truly the best answer. Now, as we transition to our questions, I'm going to give Ruth a much larger introduction. And I want to mention that as I went through these questions and prepared the slides today, I had some questions as to what was the best answer.
Yeah, I didn't give Jodi a key.
Yeah. Now I had to go answer like 25 questions. And I'm like, ooh, and these are hard, you know? And these questions have come from Ruth's book. which is a massage therapist's guide to pathology. She has a beautiful picture of it there. It is available through Books of Discovery. It's also available on Amazon if you're looking for a used copy. The copy that is most recent is the seventh edition of the book. So 7 times Ruth has been through this book, updating it with today's conditions. So let's go ahead and we'll do a transition into our learning for today. All right, here is your pathology review for
I
the.
just want to point out this is not a picture of a pathology. This looks like an aerial shot of a river somewhere.
I know, but I loved it because of the colors with your logo
Okay,
and
fair
a
enough.
nod to Portland and a nod to the body.
Very good.
Yeah. So, but this is a pathology review for the MBLEx featuring Ruth Werner. I'm going to do Ruth's introduction, and then Ruth is going to take over from here. I'm going to be pushing the buttons. So, I've mentioned our agenda for today, and that is test taking strategy. What are the distractors? Dissecting questions on pathology with Ruth Werner, and then we will have a time after the recording to do our Q&A. So, who is Ruth? Ruth is a highly influential figure in the field of massage therapy. Uh, she is known for her textbook, yes, A Massage Therapist's Guide to Pathology, but she is also known for so much more. She has been around the massage therapy industry, and I will say 30 plus years, which, and
Yeah, 36, 37, something like that. Yeah.
36, 37. Oh my goodness, that's just impossible. But one of Ruth's really claim to fame is this evidence-informed critical thinking and just a comprehensive look at the field of massage therapy. And so we're doing this through the lens of the MBLEx today. But not only is Ruth been around for many years in the field practicing, being a continuing ed instructor, uh, she has continuing ed online, which I highly recommend after you pass your MBLEx. But also, Ruth hosts a podcast called I Have a Client Who. And that is with ABMP, and you can find it on all the places you listen to podcasts, whether it's Apple or Spotify. Uh, but very fun conversations about pathology. And there's lots of episodes you can go and listen to when it comes to client care. We are going to start. We have three systems of the body today: the musculoskeletal system, the respiratory system, and the digestive system. Uh, we are going to go through a series of questions in each category first, and then we're going to do wild card, where they're coming from every category. Yeah,
Okay.
yeah. All right, let's go to we're going to go to speaker view. There we go. And here we go. So again, the first few questions, you'll be given the category, but then we're going wild card. And
So we'd like to hear from all of you, whether you can see the whole slide or if you have to move the window with all of our pictures around to
yes,
do
so
that, or
put
just
that in
make
the,
sure that you can see all the things. And I have to confess, some of these slides have a boatload of words on them because you have to tell a little story.
oh, good. Everybody says they can see. All right, let me do the, all right, that's great. Okay, everybody says I can see, I can see, I can see. All right, we can proceed. The floor
All
is
right, very
yours,
good.
Miss Ruth.
All right, thanks very much. I would like you please to not look at the ABCDE yet, if it's not too late. And just look at the stem. Your client has periodic, which means from time to time, um, acute and painful spasms of the paraspinals, which I'm sure you remember are the muscles that run up on either side of the spine. Your best strategy is to, now, before you look at these distractors, I'd like you to form in your head what would you do if your client comes in and, if you've worked in a student clinic or you're working with your friends or, in whatever circumstances you get your hands on people, you probably have had this happen. I'm getting a massage today, where I will be talking about periodic, acute, and painful spasms of the paraspinals. Um, and so think for a minute about what you would do. Have a picture in your head about your best strategy. And then now let's look at your options. So option A, avoid the affected muscles, but work with their antagonists, which of course means the muscles that do the opposite thing. I'm wondering if that was anybody's first choice. B, work to reduce pain and unnecessary tightness in the affected muscles. C, reschedule the session for after the spasmodic episodes have passed. In other words, don't work with them while they are still having these periodical spot spasms. Or D, encourage him to take an analgesic before and after his session. In other words, tell your client to take a Tylenol or something before their session and after their session. Okay, now some of these are really, really terrible choices. How many people think that D is a really good idea? Jodi, I'm going to ask you to kind of track the chat for me because I'm working between two screens. Yeah, no, no. Let me just say, telling your client to take drugs, bad idea, never the best option. Okay, good. Is there anyone who believes that this is going to be important to reschedule the session for after this person is no longer having spasms? I mean, we do massage. One of the things we do is help with muscle pain. And so there's really no safety reason that we would need to reschedule the session for after these episodes have passed. Um, that leaves us with A and B. Let's consider B, because since we're working our way up. Work to reduce pain and unnecessary tightness in the affected muscles. That seems like a decent option. Let's hold on to that. But now let's look at A. Should we avoid the affected muscles, but work with their antagonists? Now, that is a good option sometimes. And a good example of this would be if someone's having something like a Charlie horse, right? And their calf is really, really tight and painful. And you don't go in and do a deep petrissage on a cramping muscle like that. But what you can do is maybe help them exercise the opposite muscles, the antagonists. So I'm hoping everybody knows what a Charlie horse is, right? Where you get a gripping contraction. Usually we associate these with the calf. Okay, good. Right? And so that's a situation where we wouldn't go in and try to work directly on the muscle, but we might think about their antagonists. But is that the case with spinal spasms or spinal contractions? Not really. And my guess is when you were in massage school, if you had clients who had back pain that was muscular, you were instructed and taught how to reduce pain and unnecessary tightness in the affected muscles. So, I am hoping that that's clear. Jodi, is there anything else we should say about that? So the correct answer to this question is B.
All right, best answer. Boom.
Okay. Yay. B.
Next
Next, your
question.
client has a stiff neck. That is a residual consequence. That means it's, something that stays on for a long time of a car accident from several months ago. What is your best strategy? Don't look at the answers yet. Picture this client on your table. Their neck is stiff and painful. They had a car accident. The car accident was several months ago. What is the best thing you can do? Let's go through these distractors. Work deeply and specifically to release all unnecessary tension. Okay. Hold on to that. Refuse to work until you have a doctor's clearance. I will tell you right off the bat that anytime you see a doctor's note, a doctor's permission, a doctor's clearance, that you can be really sure that that is not the correct answer. And if MBLEx wants to make a fuss about that, I will fight them for you because it is never a doctor's responsibility to tell you when your work is safe. So anytime there's an issue about getting a prescription or a doctor's note or a doctor's clearance or permission, you know that one's wrong. C, refuse to work until you have seen the client's x-rays. Did any of you get any kind of education about reading x-rays for safety when you were in school? Because my guess is not. That is not within our scope of practice. So reading clients' x-rays, not the right answer. And D, work slowly and incrementally to improve range of motion. That is a possible answer. So now we're between A and D. Work deeply. Now let's go back to our stem. The client has a stiff neck from a car accident that was several months ago, so they've had this stiff neck for a long time. Should we work deeply and specifically to release all unnecessary tension, or should we work slowly and incrementally to improve range of motion? One of these answers is safer than the others. And I'm interested to know, Jodi, can we just have them put into the chat which one they think is the best answer?
Yes, we can. So
Throw it in.
just throw it on in. I'm checking the chat right now. Ooh, Bria. Bria nailed it.
I'm seeing lots of D's. That's
Lek and
awesome.
Raven and Erica, Jen,
Yeah.
Araluz, Migdalia, Dora, Naomi, Brenda,
Good.
Lydia, Edgar. Mm-hmm.
Excellent. And the reason that D is a better answer is that if we try to make a big change in a short period of time, it's likely to make things unstable, right? Um, and there's data about that. But the main thing is here, our focus is on safety. We've identified the two best options. We've chosen the safer one. Work slowly and incrementally, piece by piece, bit by bit, to improve range of motion. Awesome, you guys. Okay, Jodi, let's move on. What is an accommodation that a client with advanced osteoporosis might need? All right, so first I want you to think about your great grandma is coming to see you for a massage, and she's 82, and she used to be 5'10, and now she's 5'4. So she's shrunk, and she has a lot of pain and stiffness, and her spine is very fragile. She'd like to get a massage from you. What are you going to do in your head? Just envision what you want to do for her. What kinds of accommodations are going to make her more comfortable. So, help getting off the table due to dizziness. That's an option, but it's not a good one because osteoporosis and dizziness don't really go together. B, extra deep pressure on the paraspinals to undo chronic spasm. Let's think about extra deep pressure for someone whose bones are crumbling. Not a great option. C, imaginative bolstering on the table. So you've got something under her neck, and you've got something under her shoulders, and you've got something under her knees. All of these things to help her feel nested on the table, safe and secure. That's a good answer. And D, clients with osteoporosis should not receive massage. There's no reason people should not receive massage if they have osteoporosis, if the massage can be done safely. And we do that safely by using good, careful pressure and imaginative bolstering. Jodi, and you have anything to add to that?
I do not. Fantastic. We got great answers as you worked through that rationalization of the
The
questions.
rationale. Yeah.
Yeah, the rationale. Bria and Erica, Raven, Migdalia, Arluz, Naomi, Lek, they all got there. Brenda, Dora,
Good.
Edgar, they all got there on letter
On their
C.
own.
Yep.
That's
Yay.
fantastic. And again, the key here, because these questions, I chose the advanced questions. There will be pathology questions on your MBLEx that are not this advanced, and they'll be more about vocabulary and sort of, point to point reasoning. These are situational. They're the hardest, but if you picture that situation in your head before you start looking at the answers, you will probably be in a stronger position. Let's move on, Jodi.
Got it.
Okay. Oh, here's a good one. This one kind of caught Jodi up a little bit. Your client has a 2-month-old mild strain injury to her gastrocnemius. What type of massage is most likely to be helpful to her? All right, I would like you to picture a person who 8 weeks ago, they kind of tweaked their gastroc. It's still bugging them, but it's 8 weeks ago. It's not acute. and they would like to return to being able to walk their 4 miles or be able to run their 5K or do whatever it is they would like to do that they're now limited in because of this mild injury in their gastric. What can you do to be as helpful as possible? What type of massage is most likely to be helpful to her? So here are options. A, lymphatic drainage or other work to limit edema as possible. B, this injury is a local contraindication until all swelling has resolved. C, cross fiber friction and linear friction to work with growing scar tissue. Or D, tapotement and skin rolling to access sensory neurons that supply the scar tissue. Well, let's work through these. A, lymphatic drainage to limit edema is no longer really an issue because this is 2 months old. The edema has cleared. Same for B. This injury is a local contraindication until the swelling has resolved. Well, swelling has resolved. It's 2 months old. C, cross fiber friction and linear friction to work with growing scar tissue. Let's hold on to that. And D, tapotement and skin rolling to access sensory neurons that supply the scar tissue. Truthfully, either C or D are possible, but for this level of knowledge, C is the best answer. Cross fiber friction and linear friction to work with growing scar tissue.
Yay. Lots of right answers in the chat. Everybody
Excellent.
was right on board with your explanation. Yep.
Okay. I mean, the truth is, the more we learn about massage and nervous system things and the nerves in the fascia and the scar tissue, there's benefit to these options of tapotement and skin rolling. But the where the rubber hits the road, right? Where the lubricant hits the skin is
Mhm.
when we are actually manipulating the tissue.
Okay.
All right, let's
Erica's
move on.
asking if you could just explain just a little bit more about why C is a better answer than D.
Sure. Um, Well, first of all, tapotement doesn't really belong here because tapotement is not one of the techniques that we see for neurological to access neurological input in the fascia. Skin rolling is way more effective for that. But skin rolling is not as specific as we might look for. Skin rolling might be great for someone who has a lot of fascial restriction, but if we have a tear in the gastric, we need to access that more specifically. Cool.
Yep. And I would just add that a key part of the stem is that it's a 2 month old mild strain.
Mild strain.
2 months
Yeah.
old. We don't
If
have
it were
to.
a 2 week old moderate strain, our answers might look a little different.
Hmm.
I would have given you some different options in any case.
Beautiful. Oh, moving along, going to the
Okay.
respiratory system.
Respiratory system. This is what I gave Jodi is very overbalanced to the musculoskeletal system just because there's more stuff that massage therapists work with.
Hmm. Hmm.
All right, this is a good one. Listen carefully. Your client is in recovery from a cold. She isn't feverish or achy, but she's still coughing and blowing her nose a lot. By the way, I don't have a cold. I just live with a cough. This is a chronic thing for me. She's still coughing and blowing her nose a lot. She really wants a massage. What is your best option? A, delay her massage until all of her symptoms have subsided. B, give her a massage and recommend that she drink lots of water and take a hot bath with Epsom salts to clear the toxins from her body. That's a hint. C, give her a massage and add extra focus on helping her sinuses to clear if you happen to have that skill. D, give her a massage but wear gloves and a face mask to reduce the risk of getting sick. I want to point out that I wrote this question pre-COVID. Okay. So So, our sensitivity around communicability of respiratory infections now is quite different, but this is specifically about a cold. She is no longer feverish or achy. Her cold is over. She's still in the recovery phase, which means she has a lot of gunk to get out of her body, but she's no longer communicable. Um, Clear toxins from the body is a hint that that's the wrong answer. Okay.
Amen.
Yeah, toxins. No. Thank you. Thank you for playing. Um, So this actually gives us three interesting options. Delay her massage until all of her symptoms have subsided, give her a massage with focus to help her sinuses clear, or give her a massage but wear gloves and a face mask. We're going to eradicate D because we have established that she is no longer communicable. Okay. So that brings us to extra focus to help her sinuses clear or delay her massage until her symptoms have subsided. Have you ever worked with a client who's getting better from having had a cold or a flu? You probably have. And that's fine. You really don't need to delay her massage until all of her symptoms have subsided. If you're like me, those symptoms might last a couple of weeks. Um, and so we can give her a massage. And what we want to do, if it's within our skill set, is focus on helping her sinuses to clear. One way we can do that is to make sure that she's comfortable in a face cradle. Because even if you don't happen to know lymphatic massage or, no sinus pressure points or whatever, one thing we can offer to our clients who have a lot of congestion is to not put them face down in a face cradle because there's nothing worse. Okay.
Fantastic.
This
And
is an interesting answer. Could it vary? Yeah, Bria, you're right. This could vary a lot. And it's interesting to read and present this question now in a COVID informed world. So if I were to rewrite this question now, um, I might clarify to add extra focus if you have skills to help her sinus clear. I might eradicate the gloves and face mask option and put in something else. Um, but because we are so sensitized again to communicability right now. So it's an interesting little, very subtle cultural shift that's happened uh,
mhm.
since the pandemic. And
And
I
you're
don't want to suggest that the pandemic is over. I have probably half a dozen people who are down with COVID right now.
mm. And the majority of our grads went towards A. So this is,
Interesting.
uh-huh.
Okay.
Yeah. All right. Next question.
Let me just speak to that, Jodi, and
Sure.
to you guys. Um, with a cold, once the fever is over, the person is no longer communicable, right? So once the fever has passed and they're getting better instead of worse, all of those remaining symptoms are her body working on, or their body working on flushing out, getting rid of all the garbage, the dead cells, the dead white blood cells, the dead, whatever, the extra mucus that we created while we were fighting this cold. So communicability is not an issue, but they're very busy because they have to rebuild all that damaged tissue. Okay, let's move on.
Got it.
Your client is basically healthy. Again, this is another pre-COVID question. Your client is basically healthy. So he starts out fundamentally healthy. He got a flu that complicated into pneumonia. He's just beginning to feel better after a hard few months. He'd like to receive massage. What is your best option? Okay. So here are our options. Do only light work with him because he's still fragile and at risk for relapse. Be careful not to over challenge his adaptive capacity. Let me just define that term, adaptive capacity. Um, I'm sorry, I'm reading Dora's thing.
Mhm.
Let me back up and read Dora's question. Is A totally wrong? Because if someone's coughing and have a cold, that is bacteria. So can the therapist have a choice to postpone it? Certainly, you always have the choice to postpone it. But I want to point out again, as I mentioned, that once the with a cold, this is different with other respiratory infections, right? But with a cold, once that has begun to recover, the communicability issue is over. The last thing I want to point out about this, Dora, which may become important in some other contexts, is that colds are caused by viruses, which can be, which cannot be treated by antibiotics. Bacteria cause other kinds of infections that can be treated by antibiotics. And so I want you to be clear in your head that bacteria and viral infections have some different qualities that are important to remember. Okay, so let's talk about our flu guy. Yeah, you bet. Let's talk about our flu guy. Flu is also a viral infection, but pneumonia is usually bacterial. Um, so in that case, it's a issue where the bacteria take advantage of someone who's a little weakened and set up shop in his lungs. Okay. He's just beginning to feel better after a hard few months. He'd like to receive a massage. What is your best option? So think about this guy. He's had a really hard time. He's feeling better. Let's say he's cleared to return to normal daily activities. Um, but he's really, really worn out and he'd like to receive massage. What do you think about what your best option is as he comes in, knocks on your door to come in for his massage? So only do light work with him because he's fragile and we don't want to risk relapse. Don't over challenge his adaptive capacity, which is to say, overwhelm his system with too much challenge with massage. Okay. Or B, delay his session until he has no more symptoms. Or C, give him a session gauged to his tolerance. Again, that tolerance refers to adaptive capacity, right? What he can keep up with. When we do massage, we challenge the body, but we can challenge it a little bit or we can challenge it more. Okay. Or D, give him a vigorous massage therapy session that forces his body to respond to challenge and resets his immunocompetence. Okay. Let's get rid of D. What we don't want to do is with someone who's been sick, force his body to respond to challenge. Truthfully, sometimes that's appropriate, especially with sports massage, or if you've done any work with hydrotherapy and you want to, do a hot cold flush or something like that. But this is not our guy, right? So we're going to get rid of D. Delay his set. If we look at B, delay his session until he has no more symptoms. That may be another few months if we consider fatigue to be a symptom. That's not fair or necessary. Okay. And so that leaves us with A, do only light work. That only is a key here because it locks you in. Do only light work because he's fragile. He's a delicate flower. Or C, give him a session gauged to his tolerance. And I see some of you have put C, and that's the correct answer. And
Ooh.
the reason that is more likely to be the correct answer, really?
Yep, I got it wrong.
Yeah. The reason C is a better answer than A is the client starts out as basically healthy. He was not immune compromised to begin with. If our client had been someone who were already fragile and then he got flu and then he got pneumonia, he's going to be a much different case than your client who was basically healthy to start with. Okay. The other thing I'll say is do only light work with him locks you in to only one option,
Hmm.
only one style. Where
Hmm.
give him a session gauged to his tolerance means exactly the same thing as A. Do you see that, Jodi? That
Hmm.
C means the same thing as A. To be careful not to over challenge his adaptive capacity, but understand that that's a moving target, right? So we give him a session gauged to his tolerance. I hope that that's clear. Are there, and I want to invite questions on this.
We've got the majority of people who said C. Yep. Couple who said A, but heard. Yep.
Okay. I get wanting to do A because we are coached to be as conservative as possible.
True.
Um, but that basically healthy thing here, I'm trying to use my mouse on the screen that's not working. The basically
But
healthy
basically
thing
healthy.
is your clue that this guy is not fundamentally fragile. Okay, let's move on.
So, excuse me, I need some help.
Yeah.
I have problem with my screen now. Could I leave the room first and come back? Could you pause a little bit, please? I got a problem. I cannot see the screen now.
Jodi, that's a technical problem. So it sounds like Lex going to check out and come back in again.
That's fine. Tara's waiting
Yeah.
for you to let you into the waiting room.
Okay, sorry. Thank you so much.
That's
Oh
okay.
my gosh.
And that's good for everybody. If for some reason you have trouble seeing the screen, just log out. We'll let you back in at any point during the class.
Now they are not let me log out. I don't know.
Okay. I think we'll leave that between him and Tara, and you and
Bingo.
I, we will continue. Oh, wait a minute. Thank you. I like you explain how letter A could box you in. Very good. All right, good, Raven. I'm glad. Oh boy, let's talk about the gut.
We'll talk about the gut next. Do you want to address the box in question or wait till later?
She said she understands it, that the
Oh,
boxed in
okay.
thing was a good clarifier.
Awesome. All right.
Good.
Yep.
Thanks.
Now time to talk about the
Could have been
gut.
he. Sorry, Raven. I may have misgendered you. I don't know. Okay.
All right. After these next few questions, you won't be getting the category.
Oh, you'll figure it out. Context clues.
Ooh.
You or she. Okay, awesome.
All right.
Digestive system. All right, here we go. We've got another basically healthy client. Oh, wait a minute. We're starting with no, with this more general question. All right, here's the deal. This is not a scenario-based question. This is a sort of general application question. So listen to this and think about it carefully and think about what you know about digestive system disorders. Here's a hint about what you know about digestive system disorders. Serious things have pretty much the same symptoms as non-serious things. That's an important thing about digestive system disorders, okay? So here's this question. It is important to pursue a diagnosis, that is, make people go see their doctor for persistent digestive pain because the symptoms of uncomplicated digestion can A, hide the symptoms of a serious disease, B, look like the symptoms of serious diseases, C, make us worry about having serious diseases, or D, make the symptoms of serious diseases worse. So, can uncomplicated indigestion, that is, your stomach doesn't feel good because you ate something that didn't agree with you. All right. Can uncomplicated indigestion make other symptoms worse? No. Can uncomplicated indigestion make us worry about having a serious disease? Yeah, maybe. Can uncomplicated indigestion look like the symptoms of a serious disease? Absolutely. Can uncomplicated indigestion hide the symptoms of serious diseases? No, not really, because they're the same symptoms. Nothing's being hidden. So the best answer is definitely B. And the guideline that I always give is if someone is complaining about a different kind of gut pain and that lasts for more than a couple of weeks, they really need to see their physician because we don't know. We can't tell. Not our job
Mm-hmm.
to tell if they picked up a virus, if they have indigestion, if they are having if hormonal shifts can make this happen, or it could be something like colorectal cancer or stomach cancer or celiac disease or anything else that really needs treatment. So I really, really encourage people to consider that non-specific sort of general GI pain in a new pattern needs to get checked out. And it's important because massage can sometimes, if we have good talent and we work beautifully on the belly, which I love, good belly
Mm.
work, that can relieve symptoms for a little while. But if they come back, we need to get more information. This is where getting a diagnosis becomes very important. Okay, Jodi, next.
Yep. Majority of people in the chat were right
Oh,
on
good.
point with you.
Want
Yep.
to be? Good, because I gave you a hint. It's a really important hint, right? That not serious things and serious things in the GI tract look a lot alike, right? Nausea, bloating, gas, pain, um, can mean almost anything. Okay, let's
And
move
I
on.
would also mention that in the question you said persistent.
Right, it lasts. It keeps going and
Keeps
going. It's not
keeps
getting
going and
better.
going. It's not getting better. Yeah.
Right. That's an important hint word. All right, sorry about all the words on this screen. It's a story. But I want you to think, I'm going to describe this client to you, and then you think about what you're going to do. So your client has recently returned from a nightmarish vacation in which she was exposed to an intestinal virus. So she got a bug that caused drastic gastroenteritis, so inflammation of the GI tract. She was vomiting and having nausea. She's no longer vomiting. She's no longer nauseated, but she feels tired and worn out, and she would like to receive massage. Can you work with her? So this is a yes or no question, but the key comes with the rationale for why it's yes or no. So if your answer, if one possible answer is yes, because gentle and relaxing work that does not challenge her capacity for adaptation, right? That's not overwhelming, may help her to feel better. Or B, no, until she has been cleared by her primary physician, this client is at risk for continued infection and she may also be communicable. C, yes, you can work with her. A dynamic, stimulating massage therapy will reinvigorate her and be a nice conclusion for her ruined vacation. Or D, no, she is still too fragile for massage therapy. She needs to reschedule when she has regained her energy. So of those, let's say you're the person who had my vision was she was on a cruise on one of those cruise ships that where there's persistent gastroenteritis. Um, if you were that person and you'd been really just having exploding from both ends for a couple of weeks, and now you're beginning to feel better, but you are worn out and you'd like to receive massage. Do you want a dynamic, stimulating session that will reinvigorate you, or would you like a gentle, relaxing session that will not challenge you but might help you feel better? And in that, scenario, there's a clear answer, which I'm seeing in the chat, which is A.
Yep.
Good.
Your graduates are agreeing with you.
Yay.
Oh, wild card section.
Wild card.
Whoop, whoop.
Okay. I mean, this is pretty straightforward. So your client has painful trigger points all over his right shoulder, back, and chest. This is describing me right now. I have mousing shoulder. Keeps my massage therapist busy. All over his right shoulder, back, and chest. He feels this pain prevents him from training as rigorously as he wants to, right? He'd like to lift weights or, do martial arts or do whatever, and he can't because the trigger points. What treatment strategy might help him achieve his goals to have less pain? All right, so you have a client. Clearly, he's pretty healthy because he's in training and he wants to be more rigorous about it. He'd like to have less pain with these trigger points. How can you help him achieve that goal? A, gentle stroking to elicit a parasympathetic response. B, direct static pressure to the spots that elicit pain until he reports numbness at the site. C, direct pulsing pressure to the spots that elicit pain, alternated with release and kneading strokes. And D, stretching of the affected areas and work on the contralateral side. Okay. Now, when I went to massage school 37 years ago, 38 years ago, the correct answer would have been B. Because we were taught with trigger points, this is how long ago I went to school. You lay in with all your pressure and you say, close your eyes, take a deep breath, and think of Christmas. Until basically you sort of beat it into submission. I mean, people left bruises. It was it was a terrible, terrible way to work with trigger points. Don't do that. So let's eradicate B. In your training, the question I would ask is what best answer shows engagement with the muscle, as in to release the trigger points? Yeah, Bria, you're on the right track. So which of these does that besides B? Is it gentle stroking to elicit a parasympathetic response, direct pulsing pressure, which is to say on, off, and then some what do we say, kneading strokes, or D, stretch the affected area, but only actually work on the contralateral side. There is definitely a best choice here, and that is C. Beautiful.
Glad I
But
got that one
I
right.
was really happy to see you got right to the most important part of this question, which is what's the best answer to show engagement with the muscle. So that's a great way to go about this. Right on. Cool. You are working. This is based on a real thing that happened. There was a case report about this. You're working at a chair massage event, like at a fair or a Saturday market or something like that. Okay. Your first time client, so this lady has never gotten massage before, is a frail looking 83-year-old lady. And I will tell you that 83 looks a lot younger than it used to look to me. A frail looking 83-year-old lady. She's 5'2", but she tells you she used to be 5'6". What kinds of accommodations might she need? So if you're thinking about our previous question about an elderly lady and accommodations, that was our lady with osteoporosis and the bolstering, right? This is actually kind of a similar situation, but you're only working with a chair. This client needs to have firm pressure that addresses the muscular spasms that cause her stooped posture. B, this client needs a doctor's permission before she can safely receive a massage. C, this client needs gentle massage at first, but firmer pressure to unlock the muscle patterns that have caused her pain. Or D, this client needs to have gentle massage that does not put her at risk for fractures of the spine or ribs. You are absolutely right. It is D. It is D all day long. Whoops, we went backwards
All
one.
right, I went backwards one. Sorry. There we go.
D. Very good. Yes, excellent. Glad to see that.
And
We're
I think
thinking about
everyone,
we're
yep,
thinking about safety and client accommodations.
yep, everybody in the chat agrees. Was
Awesome.
right on point.
Okay, boss.
Should be the next one on your screen. You are a new
There we
massage
go.
therapist?
Colorectal cancer.
Yep.
All right, now there's lots of clues all over this question. You're a new massage therapist. Your client is in the middle of treatment for colorectal cancer. Chemotherapy is wearing her out, and she wonders if massage therapy might improve her energy and resilience. What is your best response? I want you to think about this person. Maybe it's someone close to you. Maybe it's someone that you love. You've just gotten through massage school. You've just gotten your license. They are worn out from chemotherapy and they would like to receive massage to see if that helps. What's your most responsible reply? A, tell her you'd love to work with her, but you need permission and suggestions from her oncologist before you begin. B, tell her you look forward to working with her when she's finished with her chemotherapy series, but it's not appropriate for you to interfere with her cancer treatment. C, tell her that massage therapy is proven to increase the uptake of chemotherapy drugs, which means she'll be able to use smaller doses for a shorter period of time if she includes massage therapy in her treatment protocol. Or D, tell her that massage therapy is often helpful for pain and anxiety and fatigue with cancer patients, but that you need more education before you can work safely with her. I'm not going to say anything more about this question. I'm just interested to see your answers.
They are well experienced in cancer not as a contraindication
Okay,
for
but I
massage.
saw an A.
You did see an A. Best answer?
It's definitely D. Yeah. Um, so again, this is the permission question, right? This person's oncologist may or may not know anything about massage therapy. Furthermore, massage therapy can mean lots of different things, right? It can mean you're just going to lay hands on her feet, or it can mean you're going to petrissage her belly. Both of those things can be called massage. It's not the oncologist's job to give you suggestions or to give you permission. It's your job to determine if your work is safe. And in the case of someone who's in the middle of treatment, the way you determine how to work safely with that person is to get more education. Oh, says Dora. Excellent.
Hmm. Yep. I flagged this as a question for myself as well, because I was like, okay. And at the end of the day, I was like, you know what? I don't know what that oncologist knows about massage therapy. And that ended up being my kind of my tipping point to go with D. Because I
Well, and
felt like, yeah,
the hint here is you're a new massage therapist. If you're a seasoned massage therapist with advanced education in oncology massage, then you know more of the rules. All
absolutely.
right, so Migdalia was thinking B, um, and that's a decent answer, except Migdalia, that anyone who has come through cancer and cancer treatment probably needs to pursue massage with a therapist who has education in oncology massage.
Mhm.
I mean, unless it's something super minor, like they had a basal cell carcinoma removed or something like that. Yeah. Um, I'm very conservative about massage and cancer survivors. I think there are ways to do it safely, but it requires advanced education.
Very good. Spoken with someone with over 30 years experience. We'll go with that.
Okay. All right. Now we have a 2-week-old sprained ankle. Your client's 2-week-old sprained ankle does not appear to be improving. If anything, it's worse than before. Although she's following well-established protocols for treatment, right? So she's icing it, she's putting weight-bearing stress as possible on it. It's just not budging. It is not getting better. What is your best strategy? Think about this. This woman has come to you. You've been working with her and her sprained ankle. It's not getting better. What should you do? Should you continue to work with her as usual, but do it more frequently? So, say go from once a week to twice a week. Should you recommend that she see her doctor for an x ray? Should you work deeper and more specifically on her ankle? Or should you ice her ankle and recommend that she take more analgesic? All right, so we know that the analgesic one is wrong because we don't tell people to take drugs. Okay. Um, So this leaves us with A, B, and C. I'm seeing a lot of B's come in. That is, in fact, the absolutely correct answer. Because one of the things that sprained ankles can hide, um, the, one of the things that sprained ankles can hide is a bone fracture. And so, a person can have a fractured tarsal or metatarsal, and that we won't find that without an X-ray. So if you have someone who's got a sprain and it's not getting better and not getting better and not getting better, they should probably have it evaluated. Oh, Raven, that's happened to you before. Yeah. Eek. Sorry. After a car accident. Yeah. And it's, even minor fractures can be hard to find, but they take forever. And anytime you have the word foot and injury in the same sentence, you know it's going to take longer to heal.
Absolutely.
Okay.
Mhm.
Excellent. That does sound like well, yes, Dora, it is a ligament. It's, by definition, a sprain is a ligament, but you can have a ligament injury and a bone injury at the same time, and it happens a lot. So the inflammation and the pain in that area is not going to clear up until the bone injury clears up. And this person may need a boot for a while. Okay. Your client who has emphysema. And I'll just remind you, emphysema is a lung disease where the alveoli in the lung fuse. So you get these kind of pockets, and there's not as much oxygen and carbon dioxide exchange. Okay. Your client who has emphysema has recently started using supplemental oxygen. So she's, has an oxygen tank on a little roller, and she puts on the cannula, and it pulses into her nose. What accommodations does this require? A. All right, so and visualize this person. She has a chronic lung disease that will never heal. After this class, MI must get a good, I don't know what that means. Your client has a chronic lung disease. It's never going to get better. It will only get worse. Now she needs to supplement oxygen. She has it. She doesn't wear it all the time, but she has it sometimes in a cannula that's attached to a tank. A. It is important to insist that she detach her oxygen tank while she receives massage in order to prevent hyperventilation. B, if your client wants to use oxygen while she receives massage, you need to position her in a way that makes it comfortable. She might not be able to be prone, but side lying with adequate bolstering should be relaxing. C, supplementing oxygen means she can receive a much more challenging massage, work especially on improving function in her breathing muscles. Or D, a person who supplements oxygen is not a good candidate for massage therapy, which is too challenging for such a delicate system. Never remove oxygen setup. Bria, I am not going to argue with you. That is absolutely correct. Yeah, I saw a lot of bees coming in my peripheral vision while I was reading these. There's no reason we can't work with someone who's got an oxygen cannula on as long as they're comfortable and maybe we don't stand on the tubing, right? So that would be a good accommodation. Don't stand on their oxygen tube. But sometimes, people have equipment. It could be a cannula or it could be a colostomy bag. Excuse me, I need to get rid of this scam call. Thank you. Off. That's why I kept my phone handy to grab the scam calls this morning. They may have a colostomy bag. They may have a stent in their neck that's all internal, but you know that it's there. These bits of medical equipment require some accommodation, but they do not make doing massage impossible. It just means we need to know how to help them. And you don't need to know that ahead of time, because the best question you can ask in a situation like this is, I've never worked with someone who supplements oxygen before. How can I make you as comfortable as possible? Right? And then you're a team and you're working together to figure out how she's going to be comfortable on the table. The first time I had a client who used a wheelchair, I was so terrified that I would say the wrong thing or do the wrong thing or trip over myself or whatever. But when I finally said, I'm a little nervous because I've never done this before, but I want to give you a really great massage. How can I do that for you? And he became my partner, and we were able to. He had a shoulder injury, and as a wheelchair user, that's bad news. But once you can start working with that, he had great results, and I lost a lot of fear because you're allowed to ask your clients how to help them. They know a lot. Okay, Jodi. Do we have any more?
Oh, yes.
Okay.
Did this show up for you?
Yes.
Okay.
The finish line one? Yeah.
Mm-hmm.
Okay. You were at the finish line of a 10K race. What's 10K? Is that like 6 miles?
6.2.
6.2. Okay. I knew you would know that. All right. So you're at the finish line of a 10K race. It's a hot, humid day. You're in Birmingham, Alabama on a hot, humid day. The athlete on your table is having a cramp in her calf. That's that Charlie horse we were talking about before, and it hurts like crazy. What should you do? What's your best strategy? Put yourself in that position. Your client's having a kind of cramp. What should you do? A, passively plantar or flex that foot and do deep petrissage in the belly of the calf muscle until the cramp has passed. B, passively dorsiflex the foot and work on the Achilles tendon until the cramp has passed. C, refer her to the medical tent for emergency care. Or D, give her some water and delay the rest of her session until she has fully recovered. There are some decent possibilities here. D is a reasonable possibility, but not always necessary. Okay? Because when you have a cramp, when you have a Charlie horse, what do? You stretch that muscle. Well, we can do it for them, right? When would we refer them to the medical tent for emergency care? It's when the cramp is not getting better, or if they have additional muscles going into cramp. Then that tells us that they are probably dangerously dehydrated and they need to get some fluids in them quick, right? But what we don't want to do is plantar flex the foot and then like really dig in hard on that gastrocnemius because that will just hurt more. So B, I'm seeing the B's fly in. That's absolutely the best choice. And the other thing is, and I don't know if they teach this, if they taught this where you went to massage school, but of course in the tendons of our muscles are those proprioceptors that tell us how tight we are. When we manipulate the tendons, that can help the proprioceptors send a signal that it's time to let go of that tightness. Okay, very good. Okay, this is about reasonable claims. What is a reasonable suggestion for what massage therapy might be able to do for a client who has osteoporosis? A, massage therapy may help with calcium uptake and improve bone density. B, massage therapy may help with some of the pain related to muscle spasm and postural problems. C, massage therapy may slow the progression of osteoporosis by improving digestion. D, massage therapy increases bone density and decreases the need for osteoporosis drugs. Okay. Before I go through this, I'd like to just see what answers are going to come in here. I'm seeing B's. I might have seen an A. It's already gone. Did we have an A?
We did.
Okay. Got some B's. Okay.
Mhm.
All right. B is the correct answer. We have no data that suggests that massage therapy may help with calcium uptake. And even if it did, we have no data that increasing calcium uptake might improve bone density. That's the relationship between the calcium that goes in our mouth and the density of our bones is very, very complicated and time dependent, especially on age. By the time someone has osteoporosis, assuming that they are an older person and not like a teen who was anorexic, which is another cause of osteoporosis, right? But assuming that it's an older person, someone in their 60s, 70s, 80s, by the time they have osteoporosis, taking calcium supplements might slow it down, not going to reverse it. So we're not going to see improved bone density. Massage therapy may slow the progression of osteoporosis by improving digestion. It's a stretch. You might be aware that we take calcium in our mouth and we have to digest it in our GI tract, especially in the stomach. One of the things that happens in particularly in women or females as they age is that chemical environment in the stomach changes and we begin to absorb less calcium from our diet. I don't think we can make a claim that massage therapy is going to change that. And we have virtually no data about increasing bone density and decreasing the need for osteoporosis drugs. So the best answer here, which is always going to be true, is that we can help with pain related to muscle spasm and postural problems. Okay, so we're not going to fix it, not going to reverse it, but we can make it more livable.
Could you speak to osteopenia?
Osteopenia.
Hmm.
Sure. Osteopenia, when you see the suffix penia, it means not enough of. Okay. So osteopenia is a term we use for bone thinning, but not yet at the extent of osteoporosis. There's a sort of a spectrum. Um, will massage do anything for osteopenia? Unlikely. I mean, unlikely, except for, help people have a better quality of life. Um, What do we do for osteopenia? Well, we can supplement calcium that might slow the process. But the whole osteoporosis, I mean, I'm happy to talk about osteoporosis, Jodi, but that's going to be 20 minutes.
Nope,
So,
I just wanted to mention the word osteopenia. Yeah.
yeah,
Yeah, because
osteopenia, the suffix penia means lack of. So you might sometimes hear the word thrombocytopenia, that means not enough platelets, or neutropenia, not enough neutrophils. Osteopenia, bone thinning, just means lower levels than we'd like to see.
beautiful. Next question.
Yeah, Bria, this is sort of a true or false thing. Which of these is true? It's the same way of asking this question. What's a reasonable suggestion?
Great way to look at that, which
Yeah.
is definitely true.
Yeah. Yeah. Which one of these is always going to be true?
Mm.
Just to make things more complicated, I will tell you that I read a research study a couple of years ago. I haven't seen any follow-up looking at bone density with people who got Thai massage. And, which of course is heavy pressure and lots of stretching and lots of manipulation. And there were some really positive signs about bone density and Thai massage. But we don't know enough at this point to say Thai massage fixes osteoporosis.
Hmm.
My girlfriend taught me when she was in pharmacology school, ask each, answer true or false to help eliminate the wrong one. Yeah, that's fair enough. That's sort of the same thing as asking, is this the best answer, right?
Mhm.
All right, what's an accommodation you can expect to make for a client with disc problems? So that could be a bulging disc or a herniated disc the one thing it won't be is a slipped disc because discs don't slip, but some issue where the disc is putting pressure on nerve tissue. And this could be a neck disc, or usually disc problems happen in the neck or they happen in the lumbar spine. They don't happen in the thorax because the ribs kind of stabilize everything. All right. So this is a vocabulary question because you need to know hyperextension. So what's an accommodation you can expect to make for a client with disc problems? Should we bolster them to promote hyperextension of the back? Should we bolster them to avoid hyperextension of the back? Or this client will need heat before receiving massage therapy, or this client will need to be iced after receiving massage therapy. There is a best answer, an accommodation for someone with a client who has disc problems. And I'm seeing B's come in. And that is correct, because of course, what happens in a disc, and the only options we have here are in the back. So let's leave neck discs out of this. What happens with a disc is if the back hyperextends, that's going to put more pressure on the on the disc. So we want to bolster so that their back has a little bit of stretch in it, which basically means a nice pillow under the belly and probably under the ankles as well. Good. Because, yes, Brenda, it's just because to avoid extra pressure on the disc. You have a client who lives with 3 special conditions: asthma, hay fever, and eczema. And the truth is that happens a lot, that people will have this triad of sort of allergic reactions: asthma, hay fever, and eczema. None of them are bothering her on the day of her appointment. What accommodations, if any, does she require? A, because none of her conditions are acute, no special accommodations are needed for this client. B, this person needs the cleanest environment you can provide. Swab all your surfaces with bleach, and if possible, shampoo the carpets before she arrives, because the smell of fresh carpet shampoo is so good for asthma. Okay. C, again, I want to point out that I wrote this pre-COVID, so all those hygienic precautions are, before we were talking about things like this. C, this person will do best with hypoallergenic lotion or oil and special focus on her breathing muscles for improved function and efficiency. And D, Be careful to position this client so that her nose and sinuses are not irritated by excess pressure. Put an immune system strengthening essential oil in your lotion. Okay, let's get rid of D, because the whole thing about boosting their immune system through an essential oil, that's a lot like applying medication. So we're going to lose D. C, this person will do best with hypoallergenic lotion or oil and focus on her breathing muscles. That's in response to the asthma. Let's hold on to that. B, this person needs the cleanest environment. Swab with bleach, shampoo the carpets. That's actually likely to be more irritating for someone with asthma than not, especially if things still smell like bleach and detergent. And A, because none of her conditions are acute, no special accommodations are needed for this client. Uh, I'm going to nix A because if they're allergic to something in your lotion, even though they don't have symptoms walking in, they will have symptoms walking out. So C, this person's going to be best off with a hypoallergenic lotion or oil and special focus on her breathing muscles for improved function and efficiency. I think it's a great idea for every massage therapist to have a hypoallergenic option. If it's not your first choice, at least always have something on site. Know what the ingredients are so that if your client asks you, you can answer. Um, when, when I went to massage school, it was before there were such things as massage lotions and massage oils. You went shopping for massage oil at the grocery store. And a lot of us bought cold pressed almond oil because almond oil is really lightweight and it showers off really easily and it doesn't go rancid super fast um, and it's a great medium for massage. Turns out though that like 10% of the population is allergic to it. And they either would get a rash or they'd have breathing problems afterwards. And so almond oil is not a great choice for a lot of people. So if you look at the ingredients on your lotion, whatever it is you like to use, if almond oil is one of them, that's not a hypoallergenic oil, um, which is sad because it's a really, really good option just for texture and usability. So just make sure that you know what your ingredients are. If your clients have any kind of skin sensitivities at all, just be prepared with a hypoallergenic lotion. Any questions on that?
I would make one comment that when we do our medical terminology, we look at hypo and hyper,
Mhm.
right? So hyper is up, hypo is low. And so this is a low allergic reaction. So something's got very
It's not going to
unlikely,
stimulate an allergic reaction,
right?
right?
Yeah. So
And we might call almond oil then a hyperallergenic lotion.
unfortunately.
Yeah. Yeah. Did you use almond oil, Jodi?
Oh, in school,
Did you
sure
used to
did.
go grocery shopping and get your massage oil?
Oh, yeah. Well, they supplied us almond oil in massage school.
Ah,
Yes. Yep. And yeah. And then soon thereafter, probably within 5 years of graduating, we started to see some lotions or some creams.
specially formulated for massage, which is
Yeah.
really, you guys, we grew up in a different world.
It was the 90s.
It was the 80s. All right. Yeah, I went to massage school in 83.
Woo! Go ahead, girl.
All right. Let's move on. What is the most likely adverse event? So, an adverse event is a negative outcome. Okay. Regarding massage therapy for a person who has had a joint replacement surgery. So, this is someone who's had a new hip or a new knee or a new shoulder, and they want to receive a massage after their surgery. Okay. The most likely adverse event, the worst thing that could, well, the most likely bad thing that could happen. A, osteoarthritis is a factor in most joint replacement surgeries. This condition can be spread with rigorous circulatory massage. B, overambitious stretching or joint manipulation can loosen a prosthetic joint. C, post-surgical infection, even after the scar has fully closed, Or D, persons with a joint replacement on one side are at high risk for needing one on the opposite side. Massage therapists must be careful not to exacerbate contralateral symptoms. So contralateral means, of course, the other side. Okay. There is a definite correct answer here. First of all, D is incorrect. A is completely incorrect. Osteoarthritis is a factor, but it does not spread with rigorous circulatory massage. C, once a scar has fully closed, there is no risk for post-surgical infection. And B is always true. Overambitious stretching or joint manipulation can wreck a new joint. Someone with a hip joint replacement will never have the same range of motion in their hip that they had before they had arthritis there. The same is true for knees and for shoulders. So yeah, B is true. B is the true answer. Overambitious stretching or joint manipulation can loosen a prosthetic joint, and that's a joint replacement failure. It does often happen with shoulders because people will be so excited that they have this range of motion that they didn't have before, and then they'll go too far. We don't want to help them with that.
I avoid stretching for at least 12 weeks after surgery.
Oh, easily.
Yeah.
Yeah.
Yeah. Even a gentle traction, which sometimes on autopilot I tend to do, but it
Yeah.
can upset the client. I had that happen, with a client with a joint replacement, and I just gently kind of did a little traction on their heels, and they're like, do not. And I'm like, okay, my
Yeah,
bad.
no, we leave that to their PT.
Mhm.
And if your client is interested in expanding their range of motion in that repaired joint, then that's something we also we either refer them to their PT to say, let's, go to see this expert in this, or we, with their permission, consult with their PT to talk about what's safe. That's not getting permission. That's getting information.
Mhm. Yep. Agreed.
Okay. I don't know if you guys can hear, my dog is snoring down here.
No, we can't hear it, but that's so cute.
Excuse me. All right. Your client, thank you, Raven. Your client has jaw and neck pain. She grinds her teeth. She has chronic headaches. She would like to have less neck, head, and jaw pain. Can you imagine a client like this? Right? Can you see her coming to see you? What is your best strategy? Work as usual with special focus on the related reflex zones on her feet. B, insist that she consult a dentist before making an appointment so you can be sure she is safe to receive massage. That's a lot like getting a doctor's permission. C, work inside her mouth and inside the auditory canal to decompress the joint. Or D, focus on head, neck, and jaw muscles within her pain tolerance. Follow up with her to check for adverse effects. So yes, she probably has a TMJ disorder. Let's be aware that we all have TMJ. We all have two TMJs, a left one and a right one. Hopefully, we don't all have TMJ disorder, which is when we get problems in the construction of the joint. Yeah. So the only thing here that's even close to as good an answer as D is C. And the thing about C is not all states allow you to work inside the mouth. Right? There are many states in which work inside the mouth is not within a massage therapist scope of practice. And I don't know of any massage technique that works inside the auditory canal to have anything to do with the TMJ, because that's your ear hole. So the best answer here is D, focus on head, neck, and jaw muscles within pain tolerance. Follow up to check for adverse effects. Any questions on that? Dora said C, but again, because of the working inside the ear, that's not a good answer. Plus, which you need advanced education to work safely inside the mouth, and not all states allow it. There are some states where that's just not on considered within our scope of practice. So D is definitely the best answer here.
Very much agree. Great explanation.
Okay. Okay, your client's been diagnosed with a second-degree strain. That means a moderate strain. That's up to half of the muscle has torn from a hamstring injury that she sustained yesterday. Okay, what type of massage is most likely to be helpful to her? A, lymphatic drainage or other work to limit edema as possible. B, cross fiber friction and linear friction to work with growing scar tissue. C, this injury is a local contraindication until all swelling has resolved. Or D, Topotman and skin rolling to access sensory neurons that supply the scar tissue. These answers should look really familiar to you because they're the same ones that we saw with the 2-month-old something or other muscle strain, right? I'm seeing a lot. I'm seeing some C come in. I think that's a D. I'm going to let them keep rolling in,
Mm-hmm.
and then I'm going to fight you.
Stump the pathology teacher. Ooh,
Interesting. Interesting. Okay.
we are everywhere.
Yeah. Jodi, which one did you pick?
Oh, it took me a minute, but I got there. I picked letter C
Um,
because of yesterday.
the yesterday. Yeah. Until all swelling has resolved?
No, not till all swelling. Nope. Then
A is
I'm
really
not
the best answer here.
trained. Yeah, I was gonna say I'm not trained for my
Yeah,
personal
but
knowledge
any
in.
other work to limit edema.
Mm-hmm.
So if we want to just gently drain the area.
Mm-hmm. Yep, so some gentle lymphatic drainage. Yeah, so
Yeah.
the best answer is A.
Yep.
Best answer is A. And Naomi, you got
And
there.
the
Very
reason I'm going
good.
to stand by that is the until all swelling has resolved is that means if you hold by that, you're not going to see her until the scar tissue in this um, is already gnarly and constricted and in the way. The best possible scenario is that you get your hands on it like in a couple of weeks when it's and so truthfully I should have included an answer that says delay for a couple of weeks until she's no longer acute. um
Yep.
I will concede that this is actually kind of a poorly written question,
Well,
and the
and there are
best
some
answer would have been
questions.
delay. But lymphatic drainage or other work to and that's my out, other work to limit edema.
Here we go. Other work. There you go. Yeah,
is is
exactly.
is my is my get out of jail free card. But I will concede that this is a poorly written question, and we got that by the disparity. The answers were all over the map on this.
Well, and yeah, and A and C could be 50-50, except for all.
Yeah,
Yeah. All right. Let's see if we have any questions that are.
it is a real question, though. You're right, Bria. Except that in real life, there would be an option to say, let's not work with you yet, except for maybe elsewhere on your body. Let's give this a couple of weeks to get normalized a little bit, and then we can start working with your scar tissue.
Yeah, agreed. Agreed. I would maybe, I mean, given that we're doing the massage work on every place else, and then probably compressions, so to try and limit the edema.
Yeah,
Maybe
anything gentle that doesn't hurt, really.
Yep. Second degree, though, she's likely to like jump off the table.
Yeah, because it's brand new.
Hmm.
And I have
Maybe.
had clients stumble on the curb outside my office and then come in and their ankles like swelling in front of my eyes. And it's like, I'm not working with this today. Yeah.
Let it have their response. Yeah.
Yeah.
All right. I'm going to hide us so everyone can see the questions. Nice
Okay.
big one here.
Your client has irritable bowel syndrome. Her primary symptoms are unpredictable swings between diarrhea and constipation, along with bloating and frequent gas. She'd like to receive massage, but she's worried about needing to pass gas or use the toilet mid-session. What can you tell her? Okay, so first let's clarify that irritable bowel syndrome is one of those GI tract conditions that is not dangerous, but it looks like things that could be dangerous. So the fact that she knows she has irritable bowel syndrome is a big plus. We're not going to make things worse here. But she's really worried about needing to pass gas or needing to use the toilet. So what can you tell her? A, tell her she'll be more comfortable if she has an appointment on a day when she definitely won't have diarrhea. Tell her you can create a session that will help her feel comfortable, and if she needs to use the toilet, that won't be a problem. Tell her that you're sure she can hold it for an hour and she will really enjoy her massage. Or tell her that massage therapy does not appear to be effective for irritable bowel syndrome and she may be better off seeking another kind of help. Okay. The reason A is a bad answer is the word unpredictable. Okay. Because it will be not clear for her from one day to the next whether her primary symptom is going to be diarrhea or constipation. So A is a non-starter. C, would you like to be told, oh, just hold on to it for an hour? Uh, C is, yeah, C. And furthermore, have you ever had someone on your table who's holding on really hard to a fart? They are not relaxing and enjoying their massage. Okay. So telling her that you're sure she can hold it for an hour and she'll enjoy her massage, also not a great answer. D, tell her that massage therapy is not effective for irritable bowel syndrome and she may be better off seeking another kind of help is not true. In fact, massage turns out to be really great for irritable bowel syndrome if the person can feel safe and relaxed. And so, yeah, it is mean to tell her, oh, just hold on to it for a while. You'll be okay. Um, and so B, yes, tell her you can create a session that will help her feel comfortable. And if she needs to use the toilet, that won't be a problem. That leaves the question of the gas, right? I have a friend who had a sign up in her office that I loved. It was very beautiful. It was sort of exquisitely scrolled that said, it's not a good massage until somebody farts. And I love it. I love it because it takes the stigma out of the possibility of needing to pass gas. It means if you fart, it's not that big a deal. And it opens the conversation about humans are humans and they make smells. It's part of the deal. And if you are worried about having clients who fart, this might not be the best career. But one of the things that massage therapists have begun to institute in our COVID-wise world is really good air filtration systems in their offices. It costs about $80 to get a really good air filter. Massage rooms tend to be fairly small. The air filters don't have to be super noisy, and they can even go under the table. And so the idea of having a bad smell, somebody farts, somebody has bad BO, somebody smells like they smoke, or they wear a lot of perfume, those are things that can be problematic, especially if your next client is someone who's super sensitive. So in addition to helping to filter the air of contaminants and smoke particles and viruses and bacteria, air filters can just help make your room smell better. So I consider now an air filter to be as important as a good table in a massage setting.
Love it.
Okay, good. We talked about farts. It's never a class with me unless we talk about poop or farts or pus or something.
Exactly.
Yeah. Okay, your client has plantar fasciitis and she's hoping to travel soon. I'm actually describing my a family member who was very dear to me. And she was going on a once in a lifetime trip to Rome, and then her foot started to hurt really bad. So your client has plantar fasciitis. She's hoping to travel soon. She wants to be able to walk without pain. What is your best strategy to help her? So think about this person in your life. And they've been looking forward to this trip forever, but they can't walk without pain, and they're wondering if you can help. A, massage her as usual, but add some anti-inflammatory essential oil to the lotion that you use on her feet. B, refer her to a podiatrist or orthopedist for cortisone injections, then work the area deeply to restore function to the plantar fascia. C, massage her lower leg muscles, but avoid the bottom of the foot so that inflammation is not exacerbated. D, work with her foot and lower leg muscles within pain tolerance, suggest that she invest in good walking shoes. All right, I'm going to knock A out. Again, because it sounds a lot like administering medicine. And I would add to that cannabis, THC or whatever in your oil can be anti-inflammatory, but it's not going to get us the effects that we want for long-term relief here. Cortisone injections is probably what she'll end up having to do, but they weaken connective tissue. So it's the follow-up to this that is the non-starter. Work area deeply to restore function to the plantar fascia. Cortisone, ask me how I know. Cortisone shots to the plantar fascia hurt like swear word. And the last thing you want is someone poking you in the foot after you've had a cortisone shot. Massage her lower leg muscles, but avoid the bottom of the foot. That's very unsatisfactory because the bottom of her foot also needs work. So we want to work within pain tolerance and we want to make sure that she's got the best possible shoes.
I
Ah,
got this one
I caught
wrong.
you, Jodi.
Yeah, I got
I
this one
caught
wrong.
you. Yeah. Um, Within pain tolerance is usually a good sign that you're on the right track here,
Mhm.
right? Um,
And I want to point out, look at this, avoid, like completely avoid, So those things that are so
they're a
like
little bit locked,
like only
like
or
only
always,
or
yeah.
all, like reduce all the tension.
Yep.
Yeah,
Yep.
those are danger words. Those are red flags.
So the best answer is D, not what is in green. Good.
Within pain tolerance is, or within accommodation, or within what was the word that we used? Tolerance in general.
hmm
Um, those are green flags.
Yep.
Those are
Like,
things to consider more carefully, like more positively.
hmm All right. I think we are getting towards the last two questions. We are
Okay.
at the 10:30 mark for you, Ruth, the 1:30 mark for us. So just checking in with everyone so they are aware of the time.
Okay, great. Thanks, Brenda. I'm glad that you were with us and I'm glad that you enjoyed our time here.
Yay.
Your client has extreme fever. Her nose is swollen. The skin around her nose is chapped. She's desperate to feel better. What accommodations might she need? Think about this person. Give her a standard massage. Your work is unlikely to have any specific impact on her sinusitis, but a massage might make her feel better. Give her a session that focuses on making her comfortable in her sinuses. Don't have her be prone. Elevate her head if that's helpful. Use whatever skills you have to help her sinuses drain. C. A standard massage will add to her congestion. Give her a very light and gentle massage and add an immune strengthening essential oil to your lotion. This is when you can tell I was really struggling to find a good distractor. Add something to your lotion. And D, do the bulk of the session with her prone so her sinuses can drain more easily. Keep tissues handy, right? So prone means face down. Have you ever been face down on a table when your nose is running and it feels like snot's going to fall out of your drip and it's torture. It's torture. Don't do that. B is the best answer. Okay? Because a standard massage will involve having them be face down. If you know anything about facial work to help drain the sinuses, that's a great gift. If not, just make her as comfortable as possible, which generally means not being face down and elevating her head a little bit.
Very good. Mostly bees in our chat.
Good.
Yep.
One thing I will add to this, in this question, I did not leave any open question about whether it's hay fever or a cold. You will have clients coughing and sneezing and saying, "Oh, I swear to God, it's just hay fever," and want to keep their massage. And in fact, they have a cold, which means now you have a cold. So we want to be as clear as possible with our clients about whether their symptoms are related to an allergy or a communicable virus. Okay. Massage therapy for a client with carpal tunnel syndrome is safe if A, the treatment can be done without exacerbating, that means making worse, without exacerbating symptoms. B, the treatment can be done without the use of analgesics. Hopefully, all of our treatments can be done without using analgesics. C, the client has other issues that might contribute to his symptoms. Or D, the client has carpal tunnel syndrome bilaterally. That happens. Sometimes a person will have carpal tunnel syndrome bilaterally. We see this, for instance, sometimes in pregnant people because of fluid retention, and then there's pressure on the median nerve. Okay. So if a person has carpal tunnel bilaterally, is it possible to do massage with them? It's possible. But really, the best answer here is A. Massage for a client with carpal tunnel syndrome is safe if it can be done without making symptoms worse. So for your client who has congestion in their forearm, if we can drain their forearm, right, and take some of the pressure off of the median nerve without making symptoms worse, then that's a safe application for carpal tunnel syndrome.
Fantastic.
Okay.
I'm going to move us to our closing slide because I
Okay.
believe we have, yep, there we go. We had two questions left, but we're at, yeah, yes. So, woohoo, yes, the finish line. So, I want to say congratulations for hanging in there to our graduates, to our massage school graduates, because you did a great job. Today is another brick in the wall of your foundation.
Look at
Yes.
you.
Yeah. And a big thank you, and you can certainly put your comments in the chat. A big thank you to Ruth Werner, aka Pathology Queen, uh, in her taking the time today to come and dissect questions with us. Uh, and that's
Pathology questions were rough but good. That's a good sign.
so that's
It's been a pleasure to spend some time with you and watch your responses. I want to invite you when you have a minute to breathe to visit my website at ruthwerner.com. I have a mailing list. I send out a letter about once a month, usually with examples of quilting in it because that's my thing. Um, and I have some online courses, and I have the podcast, and Jodi is helping me be more present in the world. So
Yes,
I'm
and I'm going to
happy with
pause
that.
here for just a moment because I want you to be able to see everybody because you're getting all sorts of hearts and
Yes, I'm getting those. I can see those.
okay.
Yes. Thank you, Bria.
Yeah, and
Raven, wonderful. Thank you. I'm very happy to be here. Jodi, we can do this anytime. This was fun.
oh, good. Yay. I'm glad
Yeah.
you. Yeah, it's really fun to see the responses walk through the actual kind of mindset stuff. Yeah.
Mhm. But
Um,
I do have a recommendation, and Jodi and I talked about this the other day. As you're studying and prepping, especially a topic that maybe you don't feel so strong on, write a multiple choice question. Write a
mhm.
STEM, write a correct answer, and then write three distractors that sort of look like the correct answer but aren't quite it. And that will get you in the brain of the person who's writing the questions.
Yes, and that'll be something that we add to homework. Um, which is writing your own test questions. And you maybe even did this in school because it's a great assignment in school. And so you can write your test questions when we make it a homework assignment, and you can submit them to us. And if they're good, if they're accurate, we'll add them to our practice exam. Yeah,
Yeah, that's great. I teach a community college class, and that's one of the exercises that we do.
sweet, sweet.
I mean, I see lots of, the little tiles with the names on,
Oh,
but
you can see them?
yeah, yeah.
Okay, good. That's what I would, okay, very good. Because I can't see that. So,
Ah,
um, all right. So, in closing, we're going to wrap up the recording. Again, thanks so much, Ruth, for your time. Ruth will be back on December 18th to teach another pathology class, just like we did today. But thank you again, Ruth, for being here. And I will sign off on the recording. I'll hang out for a few minutes to answer more specific questions. Uh, but look forward to seeing you again next time.
yeah, that'll be great. Thanks, everybody. And Jodi, I'll see you soon.
Yes, for sure.